My name is Sharon Smith and I am in the final year of my Bachelor of Nursing degree at UTS. For this presentation, I will be discussing nurse burnout, how this relates to the retention of nurses within the profession, and how this impacts our future generation of nurses and potential leaders. Having experienced this firsthand, I found it important to highlight the impacts that poor leadership can have on a team environment and overall productivity. Nurse retention and burnout are often linked, and they both relate back to quality of life. Psychologist Herbert Freudenberger first used the term burnout within the clinical environment in the 1970s to describe the feelings and lack of success that professionals face when they are emotionally exhausted. It is described as the loss of motivation and the emotional depletion that comes from prolonged exposure to chronic stresses within the workplace. The increased risks for developing exhaustion include high demands, low reward, emotional exhaustion, and high workloads, which have been shown to have underlying factors with overall job demands and lack of support. The role of the nurse is to improve the quality of the patient's lives, although nurses often neglect their own fatigue and well-being. Burnout is shown to have a negative effect on health outcomes for nurses and can produce destructive organisational performance, which can also be associated with patient mortality. This is a video from the Institute for Healthcare Improvement, where the CEO talks about challenges that are faced by healthcare leaders today in relation to nurse burnout.
You have to talk about it. You have to recognize that you've got a challenge. You need to have a way of measuring it. So most people will be relying on probably annual staff surveys. And if you're going to improve joy in work, you can't just rely on annual staff surveys. That does not give you the data for improvement that you need to secure the progress that you want to make. And so you need to have it towards the top of your agenda, if not right at the very top of your agenda as a leader. You need to be spending some of your time and energy tackling it. You need to go out and talk to people about how they're feeling, and all of those things are difficult for leaders to do.
One of the challenges currently within healthcare is the focus on the long-term retainment of nurses. Globally, the International Council of Nurses reports that nurse retention is currently at dire levels, and the volume of nurses that are departing the profession with years of experience is leaving our new graduate nurses with a lack of quality mentoring, support and guidance. The Parliament of Australia states that certain hospitals identified a 30% turnover of nurses every year, with 75% considering leaving the profession. The loss of staff can result in compromised healthcare for each patient, with patient safety then being impacted through nurse reductions. This results in a closure of beds within the hospital system. Nurses are then asked to cover staff reductions by filling gaps in the roster, and this is where nurse-to-patient ratios become too great, leading to feelings of frustration, stress, and job dissatisfaction. For the retainment of nurses, it is essential that there is an adequate nursing workforce, both now and looking towards the future, to be able to attain equitable and superior health results, and that the consumer approach is available irrespective of their geographical setting. Any staff shortages threaten the ability of these provisions. There are several key features that relate to nurse turnover and the high financial burdens associated with it, such as limited career opportunities, poor support, negative staff attitudes, and lack of recognition. These can lead to feelings of disempowerment and feeling unappreciated. In trying to combat these issues, nursing workforce sustainability has noted several points to consider in helping to retain staff. The first of these is leadership, building workplace capacity. This is to prepare and encourage nurse managers at every level to provide staff with suitable training and development opportunities, along with available management roles. Sturdy nursing leadership is crucial in developing workplace culture and implementing programs for future leaders. The second is retention, early career preparation and workplace support. Having new graduate nurses that are well prepared by having sound academic knowledge and a wide range of practical skill sets taught to prepare for what awaits them on the completion of their studies. having mentors in the clinical environment to support, encourage, and guide them throughout their foundational years. Lastly is productivity, enabling innovation in the workplace. Having a combination skill mix of staff, along with managers that have autonomy to create suitable workplace environments, helps to drive staff satisfaction and operational efficacies. The focus of supportive leadership is developing positive relationships to help nurses when it comes to setting foundations within the nursing environment and improving overall job satisfaction. Supportive leaders produce positive relationships, mentoring, and instill further leadership qualities in others. It is an understanding of what possibilities are achievable with the correct guidance. Leadership expectations can be daunting and overwhelming for new graduate nurses commencing their careers. It has been shown that nursing leadership plays an important role in creating employee empowerment, and when nursing managers are dependable and reliable, other nurses react optimistically to that authority and leadership. This is supported with research by Lashinger, Wong, and Grau. New graduate nurses need reliability when commencing their careers. There can be damaging effects of burnout and staff retention when leadership fails or seems to be non-existent. The clinical leadership attributes and expectations for new graduate nurses should be based around their scope of practice, legal and ethical boundaries. The delivery of high-quality nursing practice should be aligned with leaders that give new nurses autonomy and accountability that sits within their scope of practice, while equipping them with structured support and opportunities to grow professionally. Feeling confident and well supported if needing to report malpractice, any inefficiencies within the clinical setting, bullying or negligence are all signs of quality leadership, whether it is a new graduate nurse or a senior clinician. Under their duty of care, the responsibility falls with the nurse, regardless of clinical experience, to report any issues that compromises patient or employee safety, even if by doing this it could affect staff retention or burnout as a knock-on effect. With strong backbones in leadership, retention of staff will then follow. The nursing scope of practice is an outline of all activities, roles, responsibilities and decision-making that leads to an overall delivery of safe and effective patient care. Scope of practice for a nurse incorporates two parts: professional practice and individual practice. Professional practice is set by legislation and contains standards such as competency, codes of ethics, codes of conduct, and local health policies to be followed. Individual practice shows that nurse is competent and confident to perform their duties, is well educated, and is authorised by governing bodies to carry out their role. Nursing managers are accountable for influencing their team while also acting as mediators between the expected principles from both a professional and administrative perspective. They are role models who must establish an obligation towards professional standards. Leadership, motivation, empowerment, and confidence are key characteristics in heading towards a reduction of nurse burnout and loss of staff. A leader should create an environment that empowers and motivates staff and builds confidence within the team. In the words of Charles Darwin, "It is not the strongest of the species that survives, nor the most intelligent, but the one that is most adaptable to change." The aim of this presentation was to highlight the significance of leadership in the clinical environment and how when it is not effective, it can result in the inability to retain staff and produce a knock-on effect of burnout. To ensure the longevity of our new graduate nurses, they must be supported, educated, and encouraged to continue with growth within the profession while also recognising when their own self-help is necessary.